want so much to open your eyes.
So let me tell you what you see. What you see are all these rooftops. And there are people underneath those rooftops. Some of them are incredibly wealthy, some of them are struggling to make it from day to day, and some of them are completely impoverished. But what they do is they count on Halifax, and they know that Halifax is there for each and every one of them, no matter how wealthy they are or how poor they are. It is immaterial to us at Halifax when they need us, when they are sick, when they are ill, because when you're ill, we pretty much all look the same. He sold me right there. I hadn't even asked him about compensation. Didn't matter. That's where I realized this is where I wanted to be. This is where I needed to be. We are part of a greater purpose and a greater value system, and there's nowhere else in the world I wanted to be than right here.
Tell me that you'll open your eyes.
Okay, so that was a couple of years ago when we did that video, and what we need to look at when we think about the future is how do we continue the Halifax purpose and at the same time be adaptable to the changes that are going to affect healthcare from an external standpoint. The first one is the development of a community system of care. It's really the development of a roadmap so that residents of our service area can more clearly and easily identify at what points they should enter the healthcare system from the many choices that they may have. It may be a physician's office, it may be a pharmacy, it may be a home health company, it may be a hospital. It'll make their choices much more meaningful and much more discernible. The second part is partnerships, and that means there'll be a number of other entities, organizations, individuals who are not associated directly with Halifax that we will reach out to and collaboratively look at how we together can provide a higher level of care in the next 15 or 20 years. But it also allows us to create a regional approach to be able to better position ourselves depending upon how healthcare is being paid for in the future. Third is physician integration. And we need physician integration because physicians, frankly, they lead the choices and they make most of the decisions as to what types of healthcare are going to be provided to meet the needs of the patients that they're taking care of. Finally is scale. And scale is important because any organization has fixed overhead costs. It may be the facilities that we have, it may be the information systems that we have, but there is a significant component of fixed cost. And as we build scale, that allows us to lower our per unit cost, which makes us more competitive, and it makes us a better choice for each one of our patients as they're choosing who's going to provide care to them in the future. Because the individual consumer is now going to be taking more control in that decision process as we look at changes in the payment methodologies. All of these components, when we're done, will help us define how we provide care in the future. And that's why we need to all strive together as a team to be able to build the future that we can look back and forward and say, well done.